We see a lot of bunions in my practice. About 80% of my patients are women. They cannot wear shoes. They come in, they're in pain, and I always tell them, have it fixed. Bottom line is non-surgical treatment really doesn't work. And I can give you a bunion splint, I can give you an injection, it might last 3 to 4 months. Everybody's back upset. So I always recommend that the bunion should be fixed. It's a biomechanical orthopedic problem that does not go away unless the bone is realigned. The good news is that bunion surgery is extremely successful. Statistically, there are 300,000 bunion operations a year performed in this country alone. So guess what? We would not be doing bunion surgery unless it was not very successful. I have a PhD in biomechanical science, and my thesis were on bunion surgery and fixation of bunions with cannulated screws. So I can tell you, I am a specialist in the field. I have performed over 3,000 operations, and I've done a bunion surgery on my mother. So you think that if I didn't think bunion surgery was successful, I don't think I would have operated on my mother. Well, I can tell you that patients who have bunion surgery with me can walk right out of the operating room. They have to wear a special boot for 3 weeks. They have to have physical therapy after. Patients do come back for a second foot to be done. It's extremely successful procedure as long as patients follow instructions. I can tell you that the biggest problem with waiting on fixing the bunion is that there are only 2 types of cell in the human body we cannot regenerate. One is cartilage and also nerve cells. So bottom line is, if you have a bunion and you're waiting for it to get to the point where you can hardly walk, guess what? I can be the best surgeon in the world, but I cannot give you the cartilage back, which means that the outcomes might not be the same as they would be 2 years ago when you actually wanted to come in and fix it, and I would save and preserve majority of your cartilage. So for the patients who are waiting out there, don't wait. You come in, you have an evaluation, I'll tell you how it is, I will fix you. 3 weeks in a boot is not that bad. You can walk right out of the operating room. It's an outpatient surgical procedure performed under intravenous anesthesia. Everybody has it done. Everybody is thrilled about it. Please go on my website. Please check out the testimonies by my patients. I guess I should put the one by my mother as well on that. And I can tell you, it's probably going to be the best thing you've ever done for yourself.